Okay, well, welcome and thank you for joining us. Good evening, and I want to welcome you to our next bite-sized learning session. I am Ryan Kauffman, an OAFP member and a family physician in Bell Fountain, Ohio. Tonight, I will be your moderator. For tonight's session, we'll be discussing immunizations and vaccine confidence with our special guest speaker, Dr. Robert Frenck. Dr. Frenck is medical director for the Ohio American Academy of Pediatrics Teen Immunization Education Sessions, or TIES, and is an infectious disease researcher at Cincinnati Children's Hospital Medical Center, where he serves as the director of the Gamble Center for Clinical Research, assessing new vaccines and agents designed to prevent infections. Dr. Frenck's research has been published in various journals, including Clinical Infectious Diseases, Open Forum Infectious Diseases, Lancet Infectious Diseases, and the Journal of Clinical Rheumatology Practice Reports on Rheumatic and Musculoskeletal Disease. Tonight's topic comes at an interesting crossroads. As the development of a COVID-19 vaccine continues to advance, as the American Academy of Family Physicians launches a new campaign focused on immunizations and vaccines, now is the time to update our knowledge and armor up to have important conversations with our patients and parents. So we're glad to have you with us tonight. To start off tonight, Dr. Frenck will discuss the importance of vaccination and a few general tips on talking to patients and parents, update us on the COVID vaccine, and the MOBI and TIES program. I will follow that information with a little bit of information from the AAFP's new immunization and vaccine campaign and resources, and we'll finish with some questions and answers from our viewers. Before I turn it over to Dr. Frenck, if you have any questions or comments throughout the discussion, please put those in the comments section of Facebook or YouTube, wherever you are watching. We will monitor and address these at the end of the discussion. Finally, we will be recording tonight's session. It will be available on the OAFP Facebook page, the OAFP YouTube page, and on the Bite-Sized Learning webpage on our website. Thank you again for joining us, Dr. Frenck. Please take it away.
Thank you, Dr. Kauffman. And one of the first things, just thank you for allowing me to come talk with your group tonight. It's really a great privilege. And second is that if there are questions that arise that I'm not able to answer tonight, I'm more than happy to try to answer them later on so that you can just send me an email, and I'm happy to go through those. So Caitlin, you want to go ahead and we can start the slide? All right. Let's see. So we can go to so am I controlling the slides, or are you controlling the slides for me? You're on mute.
I will control for you.
Gotcha. Okay, so I'll say next. So next slide. So one of the first things to talk about really is about preventive measures. And so that, and I'm going to switch over to vaccines in just a second. One of the things for people to remember is that preventive measures do work, but we just need to use them. And so that by separation by greater than 3 feet, we found a decreased transmission by over 82%. Using a face mask will decrease transmission by 85%, and eye protection alone decreased transmission by 75%. In this meta-analysis, it did not do combined things. So if you had separation and face mask and eye protection, but my guess would be is that they would be additive. So we can get a very good protection by using our measures of appropriate distancing and using our PPE. And the reason that we're seeing an uptick now is not because these measures aren't working, it's because people are getting tired of it. That I was in the Navy for a long time, and I kind of look at this like battle fatigue, is that the soldiers can really only be at high alert for so long, and then they start to let their guard down because they think, things are okay. And unfortunately, people are letting their guard down now, and the enemy's still out there and still attacking. So we really need to keep our guard up, at least for a while longer. But I think there is some really great news on the horizon, which I'll go over in the next few slides. So next slide. And keep going. So this is the slides going over the 3 main platforms for the vaccines. The first one is the nucleic acid platform. And with that, we're having mRNA with a lipid nanolayer around it. The next one is a adenoviral vectored vaccine. So you're using an adenovirus and you're putting the spike protein gene in the adenovirus. And then the last one is a protein subunit vaccine. So you're just using, very similar to a flu vaccine, is a pure protein. And so then the nucleic acid vaccines that probably everybody's heard about in the last week or so is both Pfizer and Moderna, and both of them have had very good news, which we'll go over in a minute in the next slide. The viral vectors, AstraZeneca and Janssen, the main difference there is AstraZeneca is using a chimpanzee replication deficient mutant for the delivery system, whereas Janssen's using a human adenovirus. And then the protein subunits, the Sanofi and Novavax, are both using pure proteins that are expressed in a baculovirus expression system. Both of these protein vaccines also have an adjuvant with it. They need that adjuvant to be able to get good stimulation for the immunoglobulins, but also for a T cell response. And the good thing about all these vaccines is that we're not only seeing a B cell response, we're seeing an IgG and a neutralizing antibody titer. We're also seeing a T cell response. And that's really very important because it's really a critical part of controlling viral infections. Next slide. So one of the things people have asked me is that why do we need so many people for a vaccine study? And that the numbers are based on a few things. One is that in about 1 in 100 people, we assumed would be exposed to the virus in the community in a few months after vaccination. And we also figured that the vaccine would be about 70% effective, so prevent about 7 out of 10 infections. And so you needed really 15,000 people in the vaccine and control arms to be able to get sufficient number of people. However, if their exposure to the virus was higher or the vaccine efficacy was higher, we can get answers sooner. Unfortunately, the exposure to the virus is much higher than we wanted, but the other great news is the vaccine efficacy has been tremendously higher than we postulated, and is close to 95%. So next slide. So this is one editorial that a group of colleagues and I wrote about 2 months ago now, talking about doing COVID vaccine trials in children. So the title is at warp speed for COVID-19 vaccine, why are children stuck in neutral? So why aren't we doing vaccine trials in children? And people ask, well, why do you want to do vaccine trials in children? I think there's really 2 reasons. One is the direct effect of protecting the child himself so that that child is not getting sick. But then the other thing is the indirect, is if we can keep the child from passing the virus to other people, that would be tremendously important. And I've done pediatrics for about 40 years now, and if this virus is not passed from children to adults, it'll be the first one that I know of. If you look at the numbers, is that we now have had over 1 million documented COVID-19 infections in children. We've had thousands of hospitalizations, and about 150 children have died from COVID-19 in the United States. These were normal, healthy kids before they got COVID. So while the risk of severe disease in children is lower than it is in adults, it's not zero. And that's, like I say, one of the reasons we really need to have vaccine testing and vaccines available for children. Next slide. And so Pfizer actually, unbeknownst to us, was ready to start testing for adolescents. And so we're now testing a Pfizer vaccine down as low as 12 years of age. And we're one of 5 sites at Cincinnati Children's in the United States to enroll 12 to 15-year-olds. And the overall plan is to enroll about 600 kids 16 to 17 years of age and 2,000 that are 12 to 15 years of age. And that, so the reason that we can enroll fewer in the adolescents is because we're not looking for efficacy. We're really looking more for immunological bridging. And so what we'll do is we'll compare the immune response that we're getting from adults. And then if we're getting the same or better in the adolescents, and we know that that immune response in adults is correlated with immunity, protecting them against getting the infection, we can then say that that vaccine should be also protective in adolescents. And that's just the website if people were interested in either participating in adolescent trials or our adult trials that are ongoing. Next slide. So where are we at so far? The preliminary phase 3 results are available for Pfizer and Moderna, and both have had a good safety profile. They've had excellent immune responses. That when you compare the immune responses of the vaccinees to people that have had COVID, and we now have serum from them after they've had COVID and recovered, the antibodies and the T cell responses in the vaccinees actually exceed those of people that had the natural infection. And there's been really incredible efficacy, about 95%. And to put that in context, for the Pfizer, there were 170 cases so far of COVID detected in people that participated in the clinical trial. 162 out of 100 of those 170 were in placebo, and only 8 were in vaccine recipients. Even more impressive is that, unfortunately, there were 10 severe cases, but of those 10 severe cases, 9 were in the placebo and only 1 was in the vaccine group. And Moderna has really had very similar results. They've had 90 cases of COVID detected so far, and 85 of those were in placebo. They've had 11 severe cases, and all 11 were in the placebo group. So right now, both companies are applying for what's called an EUA, which is emergency use access, which basically will allow the vaccines to be distributed to the community. So next slide. This gives you a little bit more of a background about an EUA. And what that is that in the cases of a declared medical emergency, so COVID was declared a medical emergency in March of 2020, the FDA may allow the use of medical products that are still being tested if there are not licensed products that are available. And so vaccines used through the EUA is almost like going to the doctor's office to get a vaccine. That fact sheets containing information on the product safety and available alternative products are required. So basically like a VIS, a vaccine information sheet that we use for children's vaccines. And we'll still be collecting information about side effects. So next slide. How do we think that they're going to be distributed? Because this is a question a lot of people are asking. This is my thoughts. This is based on the National Academy of Sciences, so this is not governmental approval or anything, and this is nothing official. This is just what a lot of people have been talking about, is having 3 phases. Phase 1 would be about 5% of the population, which would be frontline healthcare workers such as yourselves, first responders, police, fire, medics. And then phase 1B would be any people with comorbidities or high-risk conditions, then going down to phase 2, which would be K-12 teachers and school staff and high-risk workers. And the reason that the K-12 teachers are put at the second phase is because of their continuous exposure to the children that, as I mentioned, we've had over 1 million children documented having COVID infections. And then phase 3 would be everybody else. Next slide. So what do I think about implementing a vaccination? I think we'll have vaccines available by the EUA soon, maybe by December. I saw an article today where somebody circled December 13th. I don't know if that'll be exactly right or not. I know that both Moderna and Pfizer have submitted their EUA applications to the FDA, and now the FDA has to review that. Pfizer has come out and said that they can deliver 50 million doses of COVID-19 vaccine by the end of this year and 1.5 billion doses by the end of 2021. That Moderna has said that they could deliver between 20 and 30 million doses before the end of the year, and somewhere around 300 to 400 million doses before the end of 2021. I think that we'll also have not only those 2 vaccines licensed, the AstraZeneca vaccine or Oxford vaccine is looking very good, and the Janssen vaccine is looking pretty good too. So I think it's likely that we'll have multiple vaccines licensed, maybe even by spring of 2021. And that a COVID vaccine for children hopefully will be available for next year. So next slide. So then switching gears a little bit about what do we do to try to get people to want to get a vaccine? And I think one of the things we're going to be switching from COVID-19 as far as this last 11 months has been understanding the virus, to sequence the virus, to get targets for a vaccine, to develop a vaccine, to test the vaccine. Now it's going to be implementing people receiving the vaccine. And so the things we're really going to have to be, it's really critical, is to be direct and honest with people. If there are adverse events, tell people about them so that they're not surprised, and discuss the benefits and the risks associated with vaccines to be given. And then one of the things too is important is to have culturally, educationally, and language appropriate written materials. Is that one of the other jobs I do is I'm the head of the IRB, the Institutional Review Board at Cincinnati Children's, and we review all the clinical research before it's allowed to proceed at Cincinnati Children's. And that one of the things that I routinely see is the consent forms are written at a level of PhDs, so that I mean, they're very well written. They have a lot of information, but it goes right over most people's heads. So trying to write it in a level where people understand, and then allowing time for parents to ask questions. One of the things that we found is that the person that answering the question doesn't have to necessarily be the physician. It doesn't even necessarily have to be a nurse. It has to be somebody that is your vaccine advocate and person that has sufficient information to be able to answer the questions and then be able to get additional information if necessary. And then the other thing, as I was mentioning before, is about using these vaccine information statements so that parents have something to take home to understand about the vaccines. Next slide. So what are the things that we found that kind of helped for parents to understand about vaccines? One of the first things that's really helped is just do a presumptive recommendation approach. Just start with the presumption that the children will be receiving these vaccines because it's due. So as an example, to say your child needs these shots today, for an example, HPV, meningococcal, and Tdap, and establish that vaccination is the normative choice. And if you're able to do that, we actually found that 75 to 80% of the parents will just say, okay, and they just get their vaccines today. Now, along the lines there, what I said is that use an example. These are examples for adolescents as far as the HPV, meningococcus, and Tdap. One of the things that we found is that people very frequently have been saying, okay, you need your meningococcus and Tdap today, and then there's this other vaccine, HPV, that we can talk about too. Once you separate that out and make it special, it makes people nervous, and then they get less willing to want to administer the vaccine to their children. So really lump them all together. They're all important. They're all necessary, and they all should be given at the same time. Next slide. And then for hesitant parents, one of the things that has been helpful is motivational interviewing. And so that instead you've said, okay, this is what we need to do today. These are the vaccines. And parents say, well, I just have some questions. Then transition to saying, well, tell me what it is that you're concerned about, and let them tell you so you're not guessing about what they're concerned about, and ask some open-ended questions. And that allows you some time to be able to then hear what they're concerned about and give them back information and ask permission. Say, may I just share some information about these vaccines? I understand what you're concerned about. I hear what your concerns are, but here's some of the facts about vaccines so that you can have all the information to help you make a decision. And really trying to keep it conversational so people think you're listening to them, and that or know you're listening to them, and that also that you're not doing what my kids accuse me of doing all the time, which is to launch into full lectures of facts about vaccines. Because we're so passionate about it, we want to make sure everybody has all the information, but sometimes by trying to give people all the information, we overload them. Next slide. So one of the things that's really interesting is that be careful when you're trying to debunk a myth, because sometimes too much talking about a vaccine myth can actually strengthen the myth in the listener's minds, so that they're just saying, the doctor's arguing too much, telling them it's too much. I really think it must be true. And that, but so really just try to find, here's the myth, and state that it's false, and here's the facts, and try to really keep it short and simple, because if the truth seems more complicated than the myth, people are much more willing to keep the myth because it's simpler. I mean, it may sound silly, but that's what people do. Next slide. The other thing too is this issue called disconfirmation bias. And so with that is that when you're presented with evidence, people are more easily accept the evidence supports their belief. And they're critical of things that refute their belief. So if you listen to a news program that supports exactly what you say, you can say, yep, they're pretty smart. They know what they're talking about. And if they say something that's a counter what you think, they can say, those people don't know what they're talking about. They're really dumb. It may just be that they have a different opinion, and maybe that they're trying to provide other information, but people oftentimes are very reluctant to receive new information. So we have to be able to give it to them slowly. Next slide. One of the things that I've found that's been the most helpful is storytelling. So as I said, I've been doing pediatrics for 40 years, so that makes me I actually turned 65 this summer. Of having things that happened to me. And I can remember, as far as with polio vaccine is that I actually had a friend that got polio. We were 4 at the time and went to LA County Hospital to visit her. And she was in an iron lung and just her head was out, and it scared me to death. And so that we now don't have to worry about polio because people tested the vaccine. We have effective vaccine, and it keeps the virus away. And so that really trying to give people an idea as far as that, saying about HPV, as far as that HPV is a vaccine to prevent cancer. It prevents cervical cancer. Who of you don't know someone that has had cervical cancer? So put it back into their realm so they can say, oh, yeah, that does make sense. I see why we need to do that. Next slide. And so this is one of the things that people a lot of times as caregivers that we don't remember. But the number one thing that convinces parents to have their children receive vaccines is us. Is that information is provided by the healthcare provider. There's all those other things that are on that slide that are important, but over and over again, the research showed it's what we say is what really sways parents. And so if we're strong in our conviction and we give very strong messages, definitive messages, it's going to be more likely parents are going to immunize their children. If we say, well, I'm not really sure about this vaccine, it's kind of new, and I don't know really what all the information is about it, parents are not going to immunize their children. Next slide. So this slide is actually showing a picture of people lining up to get the polio vaccine. And hopefully what we can have soon, I would love to be able to go back to the same place and have update with new cars and be able to say these are all people standing in line to get a COVID-19 vaccine. Because I think that's what we're going to, no, I know that's what we're going to need to be able to get out of this pandemic. Next slide. So this is a final slide just about this talk, and then just switch about the Moby and Ties, is one program we're doing at Academy of Pediatrics. But this is just to show that immunizations save lives. And what this slide is showing is on the vertical axis is a number of different prophylactic programs we do. All of them are critically important. I'm not saying we should get rid of any of them, but I'm just saying as far as if you look at the number one thing that saves lives is childhood immunizations. And the reason there's that break on the far right side of the chart with the arrow is because if you drew this to scale, you really wouldn't see hardly any of these other things as far as even showing up on the curve because the immunizations have been so effective. One thing people don't remember or don't ever think about is that in 1900, 1 out of 5 children died before 5 years of age. 1 out of 5 before 5 years of age. And the reason that doesn't happen anymore is because of vaccines. And so the next slide. And so then one of the things is that the Ohio chapter of the Academy of Pediatrics has to help promote vaccinations are 2 programs. One that's called the Maximizing Office-Based Immunizations, or MOBI, and that's a program that's focused on improving vaccination rate in infants and preteens. And then also the Teen Immunization Education Series, or TIES, which focuses more about improving vaccination rates in teens. Next slide. And so if anyone were interested, and hope all of you are interested, that at the bottom there is the contact information for Lori Winland at the Ohio chapter of the AAP, that I told her I was going to give this talk tonight, and she said she'll be looking for all of you to email her so she can talk to you about MOBIs and TIES and get your practice set up for those. Now, the great thing is that it does give you some CME for your session. It's free. We have a lot of resources that come with it that you can hand out to your parents. It also is to teach your office staff and that too. So it really has been a great program. And we give about 400 to 500 MOBI and TIES programs per year. It's given by nurses through the health department throughout the state. So it would likely be a nurse from your local health department, from your county health department, that would be actually doing the MOBI or TIES, but Lori is the contact person for that. I think that's it. Next slide. That's it. So thank you very much, Dr. Kauffman, for letting me come and talk to people a little bit tonight about COVID and vaccines. And if there are questions beyond tonight, even like I said, I'm happy to field any of those for you.
Thank you so much, Dr. Frenck. We'll talk just a little bit about the American Academy of Family Physicians resources, and then we'll open things up for some questions. Basically, we're going to put it in the chat, the new website for the American Academy of Family Physicians vaccine programs. There's a lot of great resources on this website. There is a link to the SHOTS app, which if you don't have on your phone is a great resource to help you know both the regular schedule, if you want to check something out there, as well as the catch-up schedule. Very easy way to pull up your phone and use it. So the links are there. And then some of the stuff from the new education campaign really targeted at patients. So there are some posters there that you can do, as well as things to share on your social media. So this is a great way to help get this information out to your patients. There's also a lot of really good resources here for us as physicians to be able to kind of support our process of promoting vaccines. So make sure you check out this link. It's a really good resource. Before we move to questions, I'm just going to share with you the video that they put as part of this entitled Selfless Acts Promotion, so part of this campaign. So if you've run that for us, Caitlin. Okay, so thank you all for all that you do to be heroes, and thank you for helping promote vaccines for your patients. Before we close, do we have any questions from our online, any of our online portals?
Hey everyone. We have a question here from a Dr. Magolius. I work in an African American community and there's a lot of resistance to flu shots. Any suggestions? And I'll pop this up on the video for you.
You want to handle that, Dr. Kauffman, or you want me to take a shot?
I'll let you take a shot first, and yeah, go ahead.
So, time. Is that it takes a time to build trust, and that I can tell you in our hospital is that we have community advocates that have been working with the churches, the first ladies in the Cincinnati area, the wives of the pastors have been instrumental, and we've really shown a direct correlation between them being supportive and our vaccination rates going up in the Black community.
Any other questions?
I don't see any other.
Okay, so I think we'll go ahead and wrap up because it's about that time anyway. But thank you all for joining us tonight for our bite-sized learning session. As a reminder, the recording will be available on the OAFP Facebook page, on the OAFP YouTube page, and on our bite-sized learning webpage of the OAFP website. You also find recordings of all the previous sessions there, and so I do encourage you to check it out. Our next session will be held on Sunday, December 6th at 8 p.m. right back here on Facebook and YouTube. OAFP President Dr. Mike Sevilla will be talking with OAFP member Dr. Mark McCloney on his work with the LGBTQI community. If you have suggestions for future learning sessions or have a story to tell yourself, please contact Caitlin McGuffey at the OAFP. Thank you again, Dr. Frenck, for the fabulous talk you've given us. I hope that everyone has a great evening. Please stay safe and healthy, and thank you for all that you do for your patients.